Hello.
Yes, Madam Chair, members. Darrell Kelch with the California Association of Area Agencies on Aging, representing the 33 area agencies throughout California. We're pleased to be here talking about reinvesting in the aging network and to restore dollars that fund the programs authorized in the Older Californians Act. Reinvestment will allow area agencies on aging to again provide vital services such as food distribution, home support for seniors, and additional funds will also enhance the ombudsman services that protect our seniors that are in nursing homes and assisted living facilities. Reinvestment will allow the rebuilding of the infrastructure of the aging network and the local service delivery system. A system, as the Legislative Analyst's Office pointed out, was nearly decimated with the cuts in 2008 and 2009. We believe it's time to do the rebuilding process and make the investments to repair and revitalize the aging network. A system that I'm pleased to point out is locally driven, person-centered, and is flexible to meet the needs of the local community. Reinvestment in aging services is especially significant when one considers that the funds that the state provide generate millions of dollars in local match and volunteer time. But let me speak directly to the services that you've identified in your agenda. Prior to the elimination of funds, the Brown Bag Program provided food to low-income seniors at 600 Brown Bag Program sites throughout the state. It was estimated that nearly 675,000 bags of food were given out annually to our seniors. Now, while the Federal Nutrition Program provides daily meals either through the congregate meal sites or through home-delivered meals, it's the Brown Bag Program that provided the staples that were important to keep the seniors at home and living independently. The food was arranged by area agencies on aging, utilizing providers and volunteers. And at one point, we estimated that for every dollar the state provided to this program, that resulted in $40 at the local level. All of this was lost when we eliminated the program. Senior Companion, the program engages seniors and volunteers to provide supportive services and assistance to at-risk older persons. These volunteers are a vital support system, allowing the older client to remain at home and in the community. They help the homebound senior with their chores, housekeeping, and shopping. It is particularly important to those seniors that do not have family members who are at home or close in the community to help them. This program was an incredibly cost-effective program. It required minimum overhead and generated local dollars and, as I said, volunteer time in the community. The last program I'd like to speak to is the Ombudsman. The Ombudsman program provides advocacy services to protect the health, safety, and welfare and rights of residents that are both in nursing homes and in assisted living. These 35 programs throughout the state are responsible for overseeing nearly 9,000 different facilities, both in terms of nursing homes and assisted living, and served close to 300,000 residents. These programs are very important to the aging system. But let me close by indicating that a belief that I have, and that is that as the state moves forward to implement managed health care and the coordinated care initiative that this legislature has definitely addressed, and the 8 counties that it's being implemented in, and we all know that eventually we hope the whole state. But that system is going to depend upon a strong local support system to make it work. It's those services that we're talking about in the Older Californians Act and in the federal act that will keep people at their home living independently. Thank you.
Thank you very much. Thank you very much for both of your presentations. Appreciate it very much. Any public comment on these items? Please come forward. We are going to take 1 minute of testimony on each item, please.
Good afternoon, Madam Chair, Senator Monning, Joe Rodriguez, California State Long-Term Care Ombudsman. Since 2008, the number of skilled nursing facilities that received non-complaint-related unannounced visits from an ombudsman declined by more than 25%. The number of residential care facilities for the elderly that received those non-complaint-related visits to check on the well-being of residents dropped by more than 2/3. In 2008, the program, before we lost general fund, had 183 paid staff. Today, we're down to 105. With fewer staff and limited ability to make non-complaint related visits, fewer opportunities to listen to the concerns of residents, our complaints in both nursing homes and residential care facilities have dropped by more than 30%. Over the years, the legislature has given the Ombudsman program additional responsibilities beyond those found in the Older Americans Act. Ombudsman representatives must witness advanced health care directives and property transfers for residents of skilled nursing facilities. The program operates a 24-hour-a-day crisis line for residents and, along with local law enforcement, receive and investigate reports of abuse and neglect. We need general fund support to perform these mandates. Thank you.
Thank you.
Eileen Kubansky with the County Welfare Directors Association, here in support as a co-sponsor, so to speak, of the request for additional resources for training of county workers in APS, as well as state resources to support the program. The training is woefully inadequate to meet the current and future demands in this program. We've had 35% caseload in the growth in APS in the last decade, and that growth is expected to continue. And as a result, we are in desperate need of additional resources to train workers, and we are in need of support from the department as well. They need the capacity to be able to provide adequate guidance and assistance to counties in administering this program efficiently and serving our seniors well. And so for those reasons, we support those two requests. Thanks.
Thank you.
Good afternoon. Farrah McDade-Ting with the California State Association of Counties. I'd like to associate myself with Ms. Kubanski's comments on behalf of support for the APS program and training and services. Again, our population is aging at a rapid rate. We'll have 20% over 60 years old in the population in California will be that age or older in the next 10 years. So we strongly support this proposal. It's very small. We think that the training at the county level and the staffing at the state level will be a vast improvement. Thank you.
Thank you.
Good afternoon. I'm Diane Kaljen. I'm the Adult and Aging Services Director for the Human Services Department in Sonoma County. And I'm here to talk about actually one of these proposals. The Adult Protective Services Training proposal is critical to us. We have seen in Sonoma County a 20% increase in our adult protective services reports over the last 5 years. We've also been able to add staff in adult protective services, but we really want to have positive outcomes for the clients that they serve. And we think that we can accomplish that through having a standard training that every adult protective services worker receives in the state. We also need coordination of adult protective services throughout the state as well, and that would be supported by the staff person at the Department of Social Services. I'd also like to say that the Ombudsman program is primarily staffed by volunteers, and we work in partnership. Adult Protective Services and the Ombudsman program work in partnership often on cases where people have lived in the community as well as in facilities. And the other two programs, the Older California Act programs, are vital to a very, very small infrastructure that we have for serving older adults locally. Thank you.
Thank you.
Hello, my name is Chris Mathias, and I'm here on behalf of the California Social Work Education Center at UC Berkeley, and I'm here to speak in support of the APS training proposal. We've had tremendous success over the last 20 years to develop an infrastructure serving child welfare, training child welfare workers, and we want to do the same for APS workers. And that training infrastructure is already there and can be leveraged from child welfare into APS. And our adults, our elders and our seniors deserve no less. Every time I go around the state and I talk to people serving our older adults in California, I hear the same thing, which is that there is no adequate training for our workers out there serving our elderly population. So I urge you to support this request so that our workers can go out and serve our seniors in the way that they deserve. Thank you.
Thank you. And you're right on the 1 minute marker, so we appreciate that and urge everyone to replicate that. Please, welcome.
Thank you. Good afternoon. My name is Becky Emery. I'm the Deputy Director for Mendocino County Adult and Aging Services, and I'm in support of this bill on behalf of Mendocino County. And, you know, I want to explain where our staff are is at 30% increase in investigations of adult abuse in Mendocino County, and it's continuing to rise. You know, we need to be able to provide training for our staff. We are staffing up, and they are unaware of the processes, the things that they need to be able to do to complete thorough and accurate investigations and to support our community members in a very, very vulnerable population, as well as needing additional supports from the state at that level. So thank you.
Thank you very much.
Good afternoon. My name is Lisa Coleman. I'm the Executive Director with CALCOA, the California Long-Term Care Ombudsman Association. We lend our support. We ask for you to support the APS training. We see that as very important to what we do as ombudsmen in the field. I like to point out that an ombudsman, one paid ombudsman, can oversee 20 volunteers. And that's taking the Californians' investment and magnifying that effort out into the facilities. So we ask for your support in this. Thank you.
Thank you.
Hi, my name is Karen Jones. I'm the program manager for the Ombudsman Office in San Luis Obispo County. I've been doing this for about 15 years. I love being an ombudsman. I like to tell people that because people always wonder why we do this for all the struggles we have. One thing I want to point out is that there is no duplication of our services. There is no other agency in any way providing ombudsman services. We're the only ones who do this. Adult Protective Services, who I also really support, they definitely need their funding. We'd love to see them have some consistency statewide. They don't come into the facility, so there's no duplication. We're not sharing our jobs. There's no one to pick up the slack if we're gone. And I also wanted to point out that we live in a country where we've placed a dollar sign on our sick and our disabled and our elderly. The nursing home industry and the residential care facility industry is a multi-billion-dollar industry nationwide. We're the only ones who are there primarily and only for those residents. Every other agency that does anything in facilities is there for regulatory or health standards or whatever it might be, but they're not there for those individual residents. And we're the only thing standing between them and a lot of corporate profit. And I thank you for your support.
Thank you.
Good afternoon, Becky Mann, Monterey County Long-Term Care Ombudsman, and I'm here today to support the request for reinstatement of the funding that we lost in 2008. And as you've heard this afternoon, and we'll hear from others, we lost many positions throughout the state, positions that are important to the protection of some of our most vulnerable citizens. I represent over 2,000 of those citizens who are in long-term care facilities in semi-rural county of Monterey, and I would love to have them lined up behind me today, all with their comments, but they're too frail. They suffer too many cognitive deficits or multiple complex chronic conditions to be here to testify on the importance of this program. They are some of our most vulnerable citizens. They really require the voice of the ombudsman to make sure that their needs are heard and met, many estranged from families. So we encourage your support. It's a smart investment It's also bringing back monies we already had at a time when the senior population is growing exponentially, especially the older segment of that population. So thank you for your consideration.
Thank you.
Good afternoon. I'm Tippi Irwin, the Executive Director of Ombudsman Services in San Mateo County. I just want to thank you for your consideration of restoring the funding to the Ombudsman program. I think we're all aware of the abysmal failure on the part of our licensing bodies to keep the facilities safe. A strong Ombudsman program adds to that safety net for the clients that are in facilities, and I would urge you to please seriously consider refunding us. Thank you.
Thank you very much.
Hi, I'm Cheryl Simcox. I'm the Program Manager for Ombudsman Services of Northern California. We have a 13-county program area, which represents 31,000 square miles. We have approximately 1,100 long-term care facilities and 26,000 residents that we advocate for. Currently, we have 7 full-time, the equivalent of 7 full-time field ombudsmen and 43 volunteers. With those numbers, all things being equal, each would be covering a 600 square mile area. In order to recruit, train, and mentor volunteers as well as protect the elderly, we need adequate staffing levels. The Ombudsman program is the most cost-effective program in advocating for residents and resolving their issues. According to the Institute of Medicine, the recommendation for adequate staffing levels for Ombudsman programs are 1 full-time employee for every 2,000 residents. I urge you on behalf of all residents in California to restore the funding to the Ombudsman program. Thank you.
Thank you.
Hi, Margaret Ceramello. I'm the Ombudsman Services of Northern California, and I'm just urging you to restore the funding. Thank you.
Thank you very much.
Good afternoon. My name is Catherine Hundermark, and I am a field ombudsman in Placer County. I have a great honor of supporting and advocating for seniors in long-term care facilities. This is also a tremendous responsibility as we strive to prevent and investigate elder abuse and care for our most fragile citizens. Many of the people that I support are alone. They do not have family and friends to speak on their behalf. I urge you to restore funding to continue our ability to advocate and be a voice for our seniors. Thank you.
Thank you.
My name is Benson Nadell. I'm the Program Director of the San Francisco Long-Term Care Ombudsman Program, a small county that speaks large. I want to thank you for convening this meeting and review of restoring the funding to the Ombudsman Program. We lost $3.8 million in San Francisco. I lost over $100,000. Although we do depend on volunteers, we have a very complex caseload. Just yesterday, we received 6 abuse reports from APS, and we cannot have volunteers do them because they only work 5 days a week on a 40-week year. This morning, while waiting for the meeting, I got an email that a residential care facility with 53 people is closing. We convened a closure of a small facility where community care licensing bailed out at the end of 2012 and did not have a response, a mini version of Castro Valley. The regulatory system is, for both nursing homes and residential care homes, a bust, and we step into the lurch. And finally, under the abuse law, we go to other types of facilities, adult facilities, social rehab facilities, and we serve dependent adults. That's not part of our Older American Act charter. That's state charter. And we get no money to do that. Thank you.
Thank you.
My name is Isaac Taggart, and I'm a long-term care ombudsman with the San Francisco Long-Term Care Ombudsman Program. For that office, I serve as the abuse investigator, primarily in residential care facilities. This means that I am the person who goes in and does the investigations when it involves sexual abuse, physical abuse, financial abuse, and I see that week in and week out. And I ask for your support in restoring funds so that we can better protect the residents in San Francisco County so we have fewer instances like that. Thank you very much.
Thank you.
Hello again. Clay Kemp, Executive Director of the Area Agency on Aging of Santa Cruz and San Benito counties. And I'm here to speak on behalf of all 3 of the Ombudsman Program, Senior Companion Program, and Foster Grandparent Program. And reflecting back on 2008, when we were in one of the worst budget crises we've ever seen, even in that horrible situation, the legislature did not recommend defunding these programs. In fact, there was a recommendation that only 30% of their funding be cut. Unfortunately, the governor blue-penciled them, and all funding was eliminated. So there are no state funds going into any of these programs right now. So I really think it's a critical time and opportunity to refund them. I also want to echo the leveraging issue. I think all these programs deserve paid professional staff, but we're not even asking for that. We're just asking for adequate support in order to train, recruit, and provide volunteers to provide these critical services. And I don't think there's a better bang for the buck that's out there.
Thank you.
Hello, Rebecca Gonzalez with the National Association of Social Workers California chapter. I'm here to talk about the funding for the Adult Protective Services. We support that item, and we also support for the training and also for the additional staff position at the California Department of Social Services. APS has been woefully underfunded for a number of years, as you well know, especially as we compare it to the funding we see in child welfare services. It's time that we started investing in our seniors, especially as the senior population is aging, and we strongly support this request.
Thank you.
Nicole Wertelman on behalf of Alameda, Ventura, and Orange counties, also in favor of the funding augmentation for APS training.
Thank you.
Holly Lanebeen on behalf of San Mateo County, and we ask your support in the 5-year phase-out of the CalFresh waiver. Thank you.
Thank you very much. All right. That includes the public comments. Senator Monning, do you have any comments? No. All right. We will move on now to CalFresh. Welcome the panelists. Eileen Kabansky's coming up, I believe, and Ryan Woolsey from the LAO. As well as Mark Newton from the LAO. And Mark Newton also from the LAO. Phil Ansell is also here today, Chief Deputy, Los Angeles County Department of Public Social Services. Hello. Who would like to begin?
Good morning. Good afternoon, Madam Chair. I've been asked to provide some brief background and context on this issue, so I'll just jump into that.
Thank you very much.
In the CalFresh program, which provides food assistance to low-income Californians, counties administer the program, and costs for this administration are split between the federal government with a 50% share, the state with a 35% share, and the counties with a 15% share. And this funding goes to provide processing for applications and renewals, but also other things like fraud investigation and outreach activities. During the recession, the CalFresh caseload grew dramatically, and as a result, we had significantly higher administrative costs. Limited county resources meant that many counties were unable to commit their full 15% in order to access the state and federal matching funds. And this has significant implications. As an example, if counties were to spend $15 million under their match, they would lose an additional $85 million in state and federal spending, which led to some concerns about counties' ability to adequately administer the program and do so at a time when the state was emphasizing outreach and maximizing enrollment. So to partially address this issue, the 2010-11 budget package included a match waiver, which allowed counties to access the full amount of state funding that was allocated in the budget without meeting their full 15% match, so long as they did spend up to a generally smaller fixed maintenance of effort amount. This softened the effect of counties having to pull back their own spending, so that instead of losing an $85 million in state and federal funds, the loss in federal funds was only $15 million. The match waiver was originally intended to last for 2 years, but was subsequently extended through the end of this current year because of continued CalFresh caseload increases and counties' stated difficulty in meeting their match. Under current law, counties will be required to meet the full 15% match beginning this July in order to access the full amount of state and federal funding that is budgeted for CalFresh administration.
Do we know, does it appear that counties will be on track to be able to make that 15% match?
currently looking at the data to try and ascertain the extent to which counties would be able to do that. I think it varies to a significant extent across counties. In some cases, the maintenance of effort amount that is required to access the full state funding under the waiver is quite a bit lower than what the match will be, in some cases half as much. So in certain instances, and I think our panelists will be able to speak to this better, it could be a significant hurdle for counties to meet that.
Do we know if the drought's going to have any impact on this?
That is a possibility. I think the state is anticipating that as a result of the drought, food insecurity may increase, and outreach efforts are underway to reach out to those affected by the drought, which would further increase administrative costs.
Right. Okay. Thank you very much. All right. Welcome to the panelists. Please introduce yourselves again.
Hi, thank you. Mr. Mecca senses regrets, unavoidable conflicts as we near the end of the budget process here. But my name is Eileen Kubanski. I'm a senior fiscal and policy analyst with the County Welfare Directors Association, and can address some of the issues you were speaking of. I won't get into the details of the match waiver. Mr. Woolsey did a great job of succinctly explaining what it is. But just to say, essentially, it's hard to understate the growth in the caseload and the impact that's had on county operations at the very same time that the economy bottomed out and local resources dropped significantly. But it's meant that demand exceeded our capacity to put up the required matching funds in the program. It's been an essential tool in helping us meet the unprecedented demand. I mean, since the beginning of the Great Recession in 2008, caseload increased 84% to more than 4.1 million individuals. And at the same time that we've been able to meet the demand for services, the match waiver has enabled counties to maintain and increase outreach efforts and our program integrity efforts. We're requesting a 5-year phase out of the match waiver in equal increments over the five fiscal years rather than immediate elimination. Without the phase out of the match waiver, counties will experience basically a funding cliff. Many will not be able to contribute in one fiscal year the entire match amount needed to draw down their full general fund and federal fund allocation. It's going to lead to elimination of CalFresh staff, elimination of outreach efforts, and greater potential for errors and program integrity problems as counties need to rapidly adjust their budgets to meet the lower funding levels. And I'll just close by saying there's no general fund cost associated with this proposal. The budget already assumes full funding for CalFresh administration. This proposal would simply enable us to better tap into that funding to continue the work that we're doing. Thank you.
Thank you very much.
Good afternoon, Madam Chair, Senator Monning. Phil Ansell, Chief Deputy Director, Los Angeles County Department of Public Social Services, on behalf of the County of Los Angeles. I can provide you with a little bit of concrete information that will illustrate in the state's largest county how these general ideas that the other witnesses have addressed would actually play out. So let me say that the state's policy objective with respect to CalFresh is largely to maximize participation. And despite the over 80% growth since the beginning of 2008, the estimates still range that somewhere between 1/3 and 1/2 of the households who are eligible to CalFresh are not receiving it. And in fact, in Los Angeles County, our Board of Supervisors proclaimed May as CalFresh Awareness Month just 2 days ago, which is our 4th annual CalFresh Awareness Month. The maintenance of effort requirement that the LAO referred to was established in 1997 as part of the CalWorks legislation, and that established a joint maintenance of effort obligation for CalWorks and CalFresh. That was 17 years ago. In Los Angeles County, there has only been one of those 17 years where we have been required to expend county dollars above the maintenance of effort level. So for 16 out of 17 years, we have fully funded CalFresh by putting up our $37 million maintenance of effort requirement. That one year was 2009-10, where we put up $4 million in county funds above the MOE. That was the point that the match waiver took effect. And since then, with the growth in the caseload, the allocation has grown correspondingly. So today we project that if the cliff happens and the match waiver goes away without the phase out that's proposed. In Los Angeles County, as Mr. Woolsey sort of alluded to, if our county were to take full advantage of this projected state allocation for next year, we would have to double our expenditures in the CalFresh program from $37 million to $74 million. It would cost us $37 million projected in budget year to take advantage of our allocation. And we project that in just 2 more years, in budget year plus 2, it would take $50 million in Los Angeles County at a time where we have not had to put any county money beyond our MOE into this program except for 1 year, reaching all the way back to 1997. So if we are to maintain the progress that we've made as a state in increasing the number of low-income families and individuals accessing CalFresh, it's critical that we have the opportunity to approach this issue in a strategic and planful manner. Instead of a cliff, we need a gradual slope. And I want to say furthermore that the slope from that cliff that we're proposing with a 5-year phase out will, even with that proposal, because the caseload is projected to continue to grow over the next 5 years, the slope of that hill will get steeper. In other words, the amount of money that Los Angeles and other counties would be required to contribute under the phase-out proposal will grow over time, both because of the phase-out, but also because the size of the allocation will continue to grow. Because even though the economy is recovering, the caseload will continue to grow as a result of outreach efforts, state program rule changes, such as semi-annual reporting, and the implementation of the Affordable Care Act. So, in order to continue on the path that we are on of reducing hunger and food insecurity in California, we see it as critically important that the match waiver be phased out over a 5-year period so that boards of supervisors across the state can approach this issue in a strategic and planful manner. Thank you.
All right, thank you very much. Any comments, Senator Mounting? Time for public comments. Please come forward. Thank you for your presentations.
Good afternoon. Farah McDade-Ting with the California State Association of Counties. I'll keep it brief since it's late in the afternoon. We strongly support this proposal for the 5-year planned phase out of the CalFresh match waiver. We think it's a prudent way to go about it. And as both the people who just testified talked about, it is already included in the upcoming budget estimates. So we think it's a good idea, a good plan, and strongly support it. I will also add that I am speaking for the Urban Counties Caucus today as well. Thank you.
Thank you.
Kimberly Rosenberger with Service Employees International Union State Council. On behalf of our CalFresh eligibility workers, we concur with the welfare directors and encourage you to take the recommendations.
Thank you.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors and Ventura County Board of Supervisors in support of the phase out of the CalMatch waiver. In Alameda County in 2012-13, it allowed them to spend a total of $7 million more for services to clients. And I can't speak to the social services agency's budget, but I can say that looking at the budget for the county, they're trying to close a gap of $67 million a year.
Thank you very much. All right, that concludes the public comments. We are at the end of the agenda, so thank you very much for your presentations. If there's no other questions, the parts of the agenda we just had were informational, and the other items will remain open for further discussion. Thank you, everybody who came today. Thank you for your advocacy and all your great work on behalf of our wonderful people of California, and this meeting's adjourned.